I bring greetings. I am Dr. Rupesh Kalyan, consultant medical gastroenterologist. On the behalf of the World Liver Day, I would like to say a few words about the liver. The liver is the most important organ in our human body, not just because of the size alone, but also because of the innumerable number of functions it does in making sure that it controls our body to function well. So, this liver is so important so that it plays a role in controlling fat digestion. It also has a role in bile metabolism, because of which it slowly improves the amount of digestion of fat. It also has a role in proper absorption of fat soluble vitamins like A, D, E and K, and it also has a role in several other functions which controls our body glucose and other things. So there are some situations where the liver can get injured either because of some, say, viruses, some substances or some toxins, or sometimes you may not really see an obvious insult. So one of the most common insult that we notice in India happens to be alcohol. And alcohol, if taken beyond a certain quantity, can actually injure the liver in the long term, so that your liver starts to function progressively poorly, and wherein you might have to depend on certain other medications to get proper nutrition and also to maintain proper metabolism, thereby wherein a series of changes like fatty liver, cirrhosis, and which can deteriorate in such a way because the patient can change to conditions like encephalopathy, fatigue, and sometimes blood vomiting due to something called varices bleeding. When faced with such situations, you would have to reach the nearest medical center and see either a gastroenterologist or a hepatologist who would help you in managing things further, because each thing unfortunately is maintaining complications, is management of these complications, and the ultimate treatment of such things would be to think about a transplant. The other things that the liver can get affected is viruses. Viruses like hepatitis A, B, C, D, E. Hepatitis A and E are known to regularly affect. They come through food and water, and the management is supposed to be only supportive. Hepatitis B and C, one of the best treatment for this is to get vaccinated for hepatitis B, but unfortunately you don't have a vaccination for hepatitis C, but when detected you would have to be adequately treated, because hepatitis B happens to be a DNA virus. It will stay inside your body forever. Hepatitis C, there is a situation where we can talk about something called a cure. The other conditions that can also affect are certain toxins, drugs. Now we see after the onset of COVID, we have many patients who have been taking native medications coming to us with changes in their liver functions. One of the most of these drug-induced liver injury related changes, the treatment happens to be to try and support the liver to make sure its nutrition is well, and there are most of the times the patients actually do well. We have had some situations where the body's immunity acts on the liver itself, where a condition called autoimmune hepatitis can happen, and there are also other conditions called primary sclerosing cholangitis which can affect the liver in a similar way. So by looking at this, this is one reason why we tend to concentrate or give more importance to the liver, because a liver is a good store of glucose, and if your liver is not doing well, your glucose comes down, and the liver, because of its synthetic effects, it synthesizes a protein called albumin, and if your albumin is poor, you will have something called fatigue, loss of appetite, progressive weight loss, sometimes leg swelling in your face, legs, and sometimes easy bruisability because of lack of proper coagulation. These things can happen, and over a period of time we notice if the liver is not functioning, we would have to refer you to a proper hepatology center to work up towards a transplant. But overall, the optimism in treating liver disease has actually improved with the availability of newer molecules, and progressively we notice that people's outcomes have been reasonably better with the transplant being more vibrant in the country right now. And there is a new entity called non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is a situation where, unfortunately, due to changes in the lifestyles that we notice, so the best way to treat non-alcoholic fatty liver disease is to ideally prevent it, because there is no such thing as a cure for non-alcoholic fatty liver disease. So the way you prevent it is by adopting a proper lifestyle. It is better to quit or reduce the amount of drinks that you take. It is better to exercise regularly. It is better to be more active. It is better to have good choices in your food, because all these things can incorporate in some of the features that can contribute to non-alcoholic fatty liver disease. And over a period of time, unfortunately, most of these patients with non-alcoholic fatty liver disease, they go through again changes. Fatty liver, hepatitis B, hepatitis, and also followed by cirrhosis. And unfortunately, most of these changes will make the patient to get noticed at a very late stage. Sometimes some of these conditions might actually, if more injury is there inside your liver, it can contribute to something called itchiness, pale urine, fatigue, and also sometimes low vitamin D, which can also come as a consequence of all these, and calcium metabolism also will be disrupted with this. So with respect to non-alcoholic fatty liver disease alone, it is usually seen at late stages. So one way you can try and diagnose it is by doing some simple basic tests like an ultrasound abdomen, and followed by, if required, a fibroscan. The fibroscan is known to look at stiffness of your liver in different segments of it, and certain variants can be noticed by which you can assess the fibrosis from time to time. It is supposed to be a reasonably good replacement for liver biopsy. We also have so many blood tests like hemoglobin, the coagulation profile, the liver function test, which says how well your liver is functioning, whether your liver condition is primarily hepatitis based or cholestatic, or because of accumulation of bile acids, or in a mixed pattern. So it is usually one of these patterns. So this is how we start assessing. And there is also a condition called synthetic deficiency, wherein albumin goes down significantly, which reflects with the patient's clinical symptoms like fatigue, leg swelling, and decreased urine output, and sometimes changes in their patient's consciousness. Overall, we are optimistic in treating such conditions if detected at an earlier stage. The overall outlook compared to what it was, say, some 10-15 years ago has been better, with more knowledge and more training going on in these areas. And with newer molecules coming in, there is very good optimism to treat these conditions. Thank you.